Hi, hello. I'm Dr. Elzone. Hello, hello. I'm Dr. Elzone, and I hear that you got a big bump on your head. Is that true? Did you get a nice bump on your head? You get a little bump on your head right there. Well, I see that you really don't have. You must be without health insurance. I mean, the insurance in this country is terrible. Of course, of course. Oh, you got a biking accident. Oh, wow. That's really something. That's really terrible. Well, I appreciate that you came to me. Not your first choice, but your only choice. That's our kind of motto that we have. So I'm going to be performing what they call a cranial nerve exam on you. So it's going to be a series of tests that are designed to assess whether you have any kind of brain damage. Some brain damage. Dr. Hellzone is going to make you feel all better. Don't worry. It's okay. Dr. Hellzone is going to make you feel all better. Okay. So what we're going to do first is, oh no, don't worry about the payment. I accept payment in the form of acorns if you have any. I love those little guys. I eat them right up. Yes. Okay, so anyway, what we're going to do first is, I believe I'm going to have to make a small incision in your head. Okay. I hope you're okay with that. Are you okay if I make a small incision in your head? You know, it's a cranial nerve exam, and as I am not necessarily medically licensed, I don't really know how to assess that without, getting in there a little bit. So I'm sure it'll be okay. I'm sure it'll be fine. It won't hurt too bad. Well, let's see. Here we go. I'm gonna just good. And let's just give it a nice, rub. Okay, and maybe we can. Okay, so if you feel any uncomfortable sensations, if you start to feel, any kind of a draft, if you feel a little bit of a tingle in your brain area, it is because it is exposed right now. I did remove the top part of your skull. That's okay. As long as you keep looking forward, you're not going to notice that it's not there. So it's okay if you feel any kind of tingling sensation. Tingling sensations. It's perfectly normal. And you might feel So, what do you smell? I'm hearing that we're smelling nothing. Is that right? You're not having any scents appearing. Okay. Interesting. Now, why do I find that interesting? It's because, there's a rotting carcass of a dog out here, unfortunately. It's okay. Don't think about it. It smells quite terrible to me, but perhaps you've had some damage to your lesion of your interior fossa, perhaps. I think that could be possible. I read some of those words on the internet, so I think maybe that's what happened. So what I'm going to do here, I'm going to go ahead and I'm going to give that a good fix. So I'm just going to touch your brain right now. So how is that? You should be all better now. I fixed your brain nerves, so now that you should be able to smell everything correctly. Now the next part that we're going to test, is your visual nerves in your cranium. Your visual nerves, your eyes. So that's going to be your eyes, what your eyes can see. So you should be looking directly at me. Now, one thing that we can do is we can test colors. So I'm going to have to ask you to look at my shirt, and tell me what color my shirt is. What color is my shirt? What color do you think my shirt is? What color is my shirt? 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 Oh, white. I'm sorry, that nerve must have been damaged terribly. That must have been terribly damaged, that nerve. That's a shame. Okay, so that's not working very well. Well, let's see if it's all of the colors. Now, what color is this book? 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 What do you think? What color do you think that book is? It's interesting. Okay. I'm not going to. Okay. Well, why don't we just go ahead? Let's go ahead and what we're going to do. I'm gonna give your head a little bit of a sk. Give it a little sk. I'm gonna give it a little sk. I'm gonna give it a little bit of a sk. I'm gonna give it a little bit of a sk. I'm gonna give it a little bit of a sk. I'm gonna give it a little bit of a sk. I'm gonna give it a little bit of a sk. I'm gonna give it a little bit of a sk. I'm gonna give it a little bit of a sk. I'm gonna give it a little bit of a sk. I'm gonna give it a little bit of a sk. I'm gonna give it a little bit of a sk. I'm gonna give it a little bit of a sk. I'm gonna give it a little bit of a sk. I'm gonna give it a little bit of a sk. I'm gonna give it a little bit of a sk. I'm gonna give it a little bit of a sk. I'm gonna give it a little bit of a sk. I'm gonna give it a little bit of a sk. I'm gonna give it a little bit of a sk. I'm gonna give it a little bit of a sk. I'm gonna give it a little bit of a sk. I'm gonna give it a little bit of a sk. I'm gonna give it a little bit of a sk. I'm gonna give it a little bit of a sk. I'm gonna give it a little bit of a sk. I'm gonna give it a little bit of a sk. I'm gonna give it a little bit of a sk. I'm gonna give it a little bit of a sk. I'm gonna give it a little bit of a sk. I'm gonna give it a little bit of a sk. I'm gonna give it a little bit of a sk. I'm gonna give it a little bit of a sk. I'm gonna give it a little bit of a read this word right here. Read this one right here. Okay, good. And this one, can you read this one? Okay. About right here. Can you read that one? Okay, good. Okay. Alright, you did that perfectly. All correct now. Every part of it that was correct. Now, what we're going to test next, we're going to be testing your third nerve, third nerve. That is the oculometer, the trochlear, the abducens, oculometer, trochlear, abducens, oculometer, trochlear, and abducens. So the way we're going to test these, nerves, being put under for this, well, yes, I mean your skull, as you can see, your brainial cavity is exposed right now. You should be in immense pain, and I would put you under, but I'm not allowed to own or administer any kind of aesthetic. I apologize. I couldn't steal anymore. I got some from, well, what the amount that I was able to get was actually meant for fish. It was from an aquarium that left their door open last Thursday, but I used it all up. You need to use a lot of that stuff, so you're just gonna have to deal with it. I'm sorry. Shh, it'll be okay. Shh, it's okay. You don't need that anesthetic. You are fine. Okay. Now, the way we're going to test these is to follow my finger. To be testing for something called nystagmus and palsies of ocular muscle. Okay, the web Mr. Doctor website has given me all the information I need to know about this. The web Mr. Doctor. Now, follow my finger, follow the finger of Dr. Hilzone. Follow Dr. Hilzone's finger, okay? Follow the finger as it goes around, and I'm going to watch your eyes to make sure that they can follow it around the room, right? To make sure that your eyes work properly. Good. Okay. Very good. Now, up. Okay. And down. Okay. Back to the center. Then we're going to go over to the right. Okay, now we're going to go back to the center. And now we're going to go to the left. Back to the center. Okay. Were you able to follow that? Was that okay? Was that too much for you? I might have gone a little bit fast. I know I can be a little bit of a little impatient when it comes to these things. You know, don't want to be. you're seeing 2 fingers. Oh wow. Okay. It looks like your vision is a little bit broken then. So what we're gonna have to do is we're going to have to give it a little bit of a fix here. So that's going to be, okay, I think that's going to make it so now you should only see 1 finger. Is that better? Now, do you see 1 finger? Do you see 1 finger now? Okay, good. I'm glad. Okay, the treatment has been a success. Okay. So now what we're going to do now, hey, thank you so much, Falco, for subscribing again. Much love to you. You see 34.2 fingers. Well, that means that your vision has been improved even further. Normally I would charge more for that, but it's okay. I've had enough acorns for today. I'm all full. Okay. So, I gotta watch the waistline. Can't have too many. Okay, so now, what we're going to test now is your fifth ocular nerve. Cranial nerve, not ocular. I got this wrong on the exam too. Standardized tests can be so difficult. Anyway, who needs a license, right? Anyway, so what we're going to do, trigeminal controls 3 sensory divisions: ophthalmic, maxillary, mandibular. This is your jaw. We're talking about your jaw of your face. So it's a little bit different. Your jaw. This area. That part. So the way that we're going to test it is that we're going to cause a little pinprick. So, and then you might feel a small sensation, and if you feel some sensation, that's a good thing, okay? So here we go. Stipple, staple, 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 staple. Were you able to feel that? Do you need me to do a couple more? Your face is pretty It's, I got this baby back in a fire sale, back in the old Great Recession. They didn't need this back on Wall Street because there's nothing left to staple. Staple, 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 staple. I didn't need to do those. Those were some extra just for you. Because I think you're a great patient. You're a great patient and you deserve extra staples. Extra staples. Extra staples anytime you want. You know, just like little lollipops at like a real doctor. You can have staples anytime you want. Okay. Now, I think that as long as you felt that, it should be good. Okay. As long as you felt that, everything should be okay. As long as you could feel that. Okay, good. Now, what we're going to do now, the thing that we're going to test now, is that we're going to test your facial nerve. So this is going to be testing. Okay, so that's what we're going to be doing. That's what we're going to be testing. Okay, so now what I need you to do is I want you to smile. Make a big smile. Okay, good. Now I need you to frown. Just make as frowny of a face as you can. Okay, now what I need you to do now is act like you smelled something terrible. Act like you smelled something terrible. Like you smelled the rotting carcass that's over here. Okay. Okay, good, perfect. Okay, that's great, that's really good, thank you. Okay, that's really good. You're doing really well. Okay. So, it looks like that's working alright. It's working A-okay. So now we're going to test the eighth cranial nerve. The eighth cranial nerve. Which tests your vestibular Alright, so this is an audio portion. This is mainly an audio portion. Okay. So what I'm going to do is I'm going to make several sounds. And I need to see if you can identify the sounds that I'm going to make. Okay. Let's start off easy. Okay, we're going to start off easy. An easy one. Okay. I'm going to say a word. Okay. And you're going to tell me if you can recognize the word. Okay. Whiskey. Were you able to tell what the word was? I said it about need to continue testing then. Okay. Now I'm going to say a word, and I'm going to enunciate every syllable. So it's easy to tell the word that I'm saying. Okay. It's going to be as easy as I can make it for you. Okay. Okay. Now, intergalactic. Muffin. I don't know why you thought it was muffin. Your nerve is really acting up right now. This nerve. Yeah, I can feel it right here. Yeah, that nerve is really causing some trouble. It's causing some trouble. So I think what we're going to do. Okay, so now I'm going to fix it up. I'm going to fix this nerve up. Relax. Don't look up there. Don't think about what's happening up there. Relax. It's okay. It's okay. It's all okay. Everything's alright. Everything's okay. Hello, savage kid. Hello. I'm just going to touch your brain if that's okay. I'm just going to give it a little tap. It's a little tap. And then I'm going to fix it right up, okay? Ordinarily, I would need gloves. That's a good point. Well, I guess I'll just have to make sure I wash my hands afterwards so I don't get any kind of nasty brain goo on them. Thank you for being concerned for me. I appreciate that. Okay. So now, I think your word recognition should have improved. It should have improved. So I'm going to test again. We're going to test again to make sure that improved your word recognition, okay? So just let me know if you can tell the words that I'm saying, and it should be easier for you now. It should be a lot easier, okay? Because I fixed everything. relax. Try to relax. Try to relax the muscles. Try to relax the muscles. Okay. Okay. Okay, so it seems like the kids are coming out to play. And the owls and the kids are coming out to play. Well, beware. Those owls, they'll steal all your acorns. They'll steal all your acorns and they don't care. They don't care a lick. They don't care a lick for how much you need those acorns for the winter. Oh, I have a bone to pick with those owls. And you too, bird. You're on my shit list. Stealing my acorns, my hard-earned acorns, by the way. Okay. Now what we're gonna do That was very quick, Savage Kid. That was very quick, Savage Kid. Good night. 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 What we're gonna do is we're going to test. We're gonna test your spinal accessory. Spinal accessory. Spinal accessory. Spinal accessory. Spinal accessory. This is a serious possible stuff. This patient disaster against the resistance. The shoulders is a resistance supply. So be supplying this resistance. You're going to be able to push against it. So what we're going to do is I'm going to turn your head to the side. Okay, I'm going to turn your head to the side, and then you are going to try to elevate your shoulders against my resistance. Okay, so what I'm going to do is I'm going to push down right there, and you're going to try to push against me. Push against it. I'm going to push forward, and you're going to try to push back. You're going to push forward, and you're going to try to push back. I'm going to push forward, and you're going to try to push back. I'm going to push forward, and you're going to push back. I'm going to push forward, and you're going to push back. I'm going to push forward, and you're going to push back. Okay. So push it. Push it real good. And now. Going to test your, test your hypoglossal cranial nerve. Your hypoglossal cranial nerve. Hypoglossal cranial nerve. The Web Medical Doctor website has told me about this one. It's told me about this one. And we're going to evaluate that by asking you to extend your tongue. 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 And I'm going to inspect it. Inspect your tongue. Let me see. So let me just, I'll put my depressor down on that. Okay. I see. That tongue of yours. Interesting. Certain vascular lesion, could be lesion, could be an atrophy, could be perhaps some kind of witch's curse, could be something like that. Could be something like a witch's curse. That's possible as well. Okay. So it looks like everything is a-okay. Okay. So now I'm going to get the top of your skull and I'm going to just and then we're going to just need to get staple, Got a couple staples in there to make sure that your head stays firmly put. Okay. Good. Okay, well, thank you. Thank you very much for coming. And if you have any if you have a lead on any kind of spare stashes of acorns, please let me know. I'm getting very hungry again, and I tried. My cheeks just can't store as many as I used to. And so when you get older, you'll understand. Anyway, thank you. I've been, as you know, Dr. Hellzone.